and welcome to our show, Health and Wellness Myths versus Facts. In a day, your child's body performs a lot of functions, and there are different systems that are responsible for these functions. One such system is the endocrine system, which produces and releases hormones that act as chemical messengers and help control many important body functions like growth and development, metabolism, as well as reproduction. Hormones play a particularly important role in regulating growth and development, while also metabolism, hunger, thirst, reproduction, and sexual functions. These processes are extremely important for the normal development of young children. Hormonal imbalance in children can cause serious consequences. The burden and pattern of pediatric endocrine disorders are increasing worldwide. Symptoms of hormonal imbalance can vary widely as each hormone is responsible for its own role. Awareness of hormonal imbalance in children is not very high, and therefore parents do not know much about the endocrine disorders. Accurate knowledge will help parents to recognize the systems in time and to consult a doctor accordingly. We've invited eminent endocrinologists to provide medically accurate advice on preventing various endocrine conditions in children and help viewers identify long-term control strategies. Let's welcome our expert doctors. We have Dr. Anish Behl, consultant endocrinologist, Apollo BGS Hospital and Wellness Super Speciality Center in Mysuru. We also have Dr. Preyander Singh Thakur, assistant professor endocrinology and metabolism at AIIMS in Bilaspur. We have Dr. Subhodip Pramanik, consultant endocrinologist, Neosia Getwell Multi-Speciality Hospital in Siliguri. Thank you so much for joining us here on the show on NDTV. Let me take my first question to Dr. Behl. What is the role of hormones in our body and how do they work? Dr. Behl.
Thank you, Deva. Hormones are essentially chemical messengers that are secreted by the glands directly into the bloodstream. They reach different parts of the body wherein they bring about functionings like control of blood sugars, control of blood pressure, reproduction, and they help to maintain metabolism of the body. Now, hormones bring about this action by binding to their specific receptors which are present on the target cells. Now, this is something very, very similar to the lock and key mechanism, wherein a particular hormone is going to bind to its very specific receptor. This ensures a very precise mechanism of action. Now, there are a lot of glands which produce hormones like the pituitary gland, the thyroid gland, the parathyroids, the adrenals, the pancreas, the testes and ovaries. All these hormones which are produced by this gland act in unison and see to it that the day-to-day functioning of the body is kept in perfect order. Now, if there is a condition wherein there is either a deficiency or excess of these hormones, then that results in disharmony leading to various disease states, and that's where we endocrinologists come into play. Thank you.
Now, as we discuss, hormones are interconnected and their balance affects the function and health of body systems. Which hormones affect the bone health of children and how? Let me take that question to Dr. Thakur.
Yeah, thank you, Divya. So, these hormones which affect bone health, like Dr. Anish has said previously, a perfect balance should be maintained. There should be neither to excess of these hormones, neither to deficiency. So I'll just enumerate the important ones. The most important for the growth of the child is growth hormone, which leads to the linear growth, which helps in linear growth of the child. Then another ones are sex hormones, testosterone as well as estrogen. Testosterone has a more profound effect. That's why males are more stocky build as compared to females. And both of these hormones not only lead to bone growth, but lead to the fusion of the bones also, so that after a particular growth, the growth, linear growth stops. Another important hormone which can affect bone health is a thyroid hormone. If thyroid hormone is too less, then the child growth may be stunted. If it's in too excess, then another problems like osteoporosis can occur in a child. Another important hormone which is secreted from a parathyroid gland near the thyroid gland is a parathyroid hormone, which leads to continuous remodeling of the bone. Last but not the least, vitamin D, which gets converted to a hormone in our body in its active form, that is 125 dihydroxy cholecalciferol, and it also bone health in a positive manner. on the top of all these hormones, a child needs good nutrition in the form of healthy diet as well as a high calcium diet. At least 800 milligram of calcium should be there. 800 milligram per day of calcium should be there in his diet. Okay, thank you.
Right. Let me take my next question to Dr. Pramanik. Insulin resistance is becoming more common in children and adolescents than before. Why is that so?
Yeah. So thank you for the question. Insulin resistance, I would say it's becoming an epidemic in today's era. And today, as we are going through a very competitive era and the children are immense pressure, so that's why they are more prone to get more junk foods and they are more prone to have sedentary lifestyle. Now, this is actually not only their fault. Sometimes we as a parents and sometimes the class teachers are very much obsessed about a large task, large homework, and that's why they get lesser time to go outside. And also for female children, especially in the peripheries, there is a concern about safety. So that is why often parents don't allow them to play with all other boys, and that leads to more sedentary lifestyle. Now, junk food is now more available because it takes lesser time to prepare, lesser time to consume, and that's why in hurry, sometimes the parents, sometimes from outside, they bring that foods and consume. So combined with those junk foods and lesser sedentary lifestyle, they are becoming more obese, and obesity is a common factor which leads to insulin resistance. On top of that, I would add a genetic load for which more insulin resistance are coming. As we all know, today's era, the type 2 diabetes is growing exponentially, and the harbinger of type 2 diabetes is insulin resistance, and more diabetes in the parents, that leading to more genetic load for insulin resistance in the offspring, and that's why it's becoming more and more prominent, and younger generation are suffering from obesity as well as insulin resistance.
Right. So what exactly is insulin resistance in children associated with? Can insulin resistance be reversed as far as kids are concerned? Dr. Behl.
Thank you, Divya. Now, the commonest condition which is associated with insulin resistance is obesity. What we notice is that there is a direct correlation between the weight of the child and the insulin resistance. As the weight increases, insulin resistance tends to increase. Specifically, it's the fat which is present in the abdominal cavity, the so-called intra-abdominal fat, which has a very close relationship with insulin resistance. Now, there are other conditions like type 2 diabetes, which is often seen in type 2 in children these days. In fact, previously it was rare to encounter type 2 diabetes in children, but nowadays we do see type 2 diabetes or the adult form of diabetes, which is commonly associated with increased insulin resistance in children. Even things like increased blood pressure, increased cholesterol, triglycerides, these things are often seen in children because of the increased prevalence of obesity, because of change in the lifestyle that we are following these days. There is a condition called NASH, that is non-alcoholic steatohepatitis. Now, in this, what happens is there is excess deposition of fat in the liver, as a result of which we encounter problems over a period of time. Now, this condition also is closely related to insulin resistance. Adolescent girls, some of them have PCOS, that is polycystic ovarian syndrome, which is very, very closely related to obesity and insulin resistance. Now, all these conditions which I have mentioned, whether it's type 2 diabetes, whether it's increased cholesterol, triglycerides, blood pressure, NASH, PCOS, all of them are being seen increasingly in children because there is a rapid increase in the prevalence of obesity in this age group. Now, as far as reversal or reduction of insulin resistance is concerned, definitely it's possible. All one needs to do is address the weight. Now, if you are able to reduce weight because of increased physical activity or because of adopting a healthy lifestyle, insulin resistance does come down and all these conditions do improve. Drugs have a very limited role to play. In fact, the only approved drug as of now is metformin in adolescents who have type 2 diabetes. Otherwise, it's only diet and exercise to address weight. Thank you.
Right. Let me take my next question to Dr. Thakur. It is said that type 1 diabetes is mostly seen in kids and type 2 diabetes is adult onset of diabetes. But can type 2 diabetes also occur in kids? Dr. Thakur.
Thank you, Divya, for the question. Yeah. So thank you, Divya, for the question. So my job has for this question has become much easier because Dr. Subhodip and Dr. Anish has very nicely explained. As Dr. Subhodip has mentioned that in type 2 diabetes, one of the hallmark is insulin resistance. So now due to as the insulin resistance in children is also growing, he has rightly pointed out that because of our lifestyle changes, because of lot of junk food is available, lifestyle in children also has become a sedentary also. So now we are seeing lot of cases of type 2 diabetes in children also. So, and how to prevent it, Dr. Anish has again very nicely explained that we have to control the weight. That is the only thing which is gonna help a lot. And the only medication which is approved in adolescent is metformin to control type 2 diabetes as of now, along with, if needed, insulin.
Right, weight management is key, like the doctors are pointing out. But how serious is type 1 diabetes in children? Can a child with type 1 diabetes live a normal life? Dr. Pramanik.
Yeah, so I'd say this is a pretty interesting question. If I have to answer this in one line, then I must say that yes, type 1 diabetes is a serious condition, but it's a manageable condition. So if somebody have type 1 diabetes, they are always prescribed with insulin. And taking insulin for 2 times or 4 times in a day is usually the norm. Now, talking about the seriousness of this disease, there can be 2 types of complication. One is a short-term complication that is called diabetes ketoacidosis. This is nothing but if sometimes there is a drug diet imbalance, patient forgets to take insulin, or there is some serious illnesses, then due to relative deficiency of insulin, there can be high ketone body formation into the body. And ketone is toxic to their health, and it can even lead to mortality. Case fatality is also there. So this short-term complication is actually a dreadful condition, but again it can be prevented easily if the patient is taking insulin properly. Now coming to the long-term complication, that if a child has type 1 diabetic taking insulin, but if sugars are not controlled, then in the long run they can have chronic complications of diabetes like eye damage called retinopathy, kidney damage called nephropathy, nerve damage, especially the peripheral nerves, called diabetic neuropathy, and also cardiovascular diseases increases exponentially. So to summarize that, yes, type 1 diabetes is a serious condition, but if somebody takes insulin properly and maintains their blood sugar within normal limit, then all the complications can be prevented. And coming to the second part of this question, where you have asked whether they can lead a normal life, well, we have multiple examples starting from actors to cricketers who had type 1 diabetes and continuing to have type 1 diabetes, taking insulin either in the subcutaneous form or in the insulin pump, and they are jolly well leading a normal life. And in my experience at least, I have seen all type 1 diabetic patients, they are actually more talented than their peers, and they actually have some talents which through which they prosper in their life. So overall, type 1 is considered as an insulin deficient state, which if treated properly, they can jolly well live a normal life.
Right. With that, we're slipping into a very short break. Dr. Pramanik, Dr. Behl and Dr. Thakur will be joining us on the other side of this very short break. To stay with us. Welcome back. You're watching Health and Fitness. This is Health and Wellness Myths versus Facts. We have our expert doctors with us, Dr. Behl, Dr. Thakur and Dr. Pramanik joining us. What is the role of nutrition and exercise in the management of type 1 diabetes? Dr. Behl, I'd like you to answer that.
Thank you, Divya. Now, when it comes to managing type 1 diabetes, insulin is the mainstay of treatment. There are no two opinions about that. But nutrition therapy and exercise also have a very major role to play as far as care of these patients are concerned. Now, whenever we talk about diet and exercise to a patient with type 1 diabetes, the recommendation or the prescription is highly individualized. We talk to the patient depending on their needs, the need of the patient, their preferences, the family's needs, preferences, and the eating pattern. So that is something which has to be kept in mind. Now, the most important aspect of diet in patients with type 1 diabetes is to watch the carb content or the carbohydrate content in the diet, because it is this component which is responsible for spiking of sugars after a meal. Now, when we talk about diet, we have to be a little stringent, but we should not go overboard. The reason for that is we have to provide adequate nutrition for the child to grow, for the child to maintain normal growth. If you're very, very stringent with the diet, probably that also will get affected. There are two ways that we talk about diet to our patients. There are two concepts or two methods of prescribing diet. The most common or the most popular method in type 1 diabetes is what's called the carbohydrate count concept. Now here what happens is the patient adjusts the dose of insulin depending on the carbs in the meal. So this allows the patient a degree of flexibility, a choice which they or their parents can make on day-to-day basis. But the problem with this approach is it requires a lot of dedication, a lot of application, understanding, sometimes which is not possible in a country like ours. So in those situations, we insist that there should be some degree of consistency as far as meal timing is concerned, as far as the content of the meal is concerned, so that when we give them a fixed regimen of insulin, it kind of matches with the food timings. Now, exercise is as important in these children as in any other healthy child of that age group. What's important to keep in mind is that whenever we talk about exercise to these children, we should be very careful that we do not cause sugars to go down or to go up during that time when the child is exercising or the child is playing, and maybe even after that. For this, it becomes very important to adjust the food the child has eaten or the snack the child has taken before the exercise or during the exercise, and even adjust the dose of insulin. Sometimes we increase the dose or we decrease the dose. Now, if you keep these few things in mind, most of the children with type 1 diabetes can lead a normal life, as Dr. Pramanik was rightly saying. And these things have to be kept in the back of the mind. Thank you.
Right. So what is low blood sugar and how do you treat low blood sugar in children? Dr. Thakur.
Yeah, thank you, Deva, for the question. So low blood sugar, which we refer to as a hypoglycemia, is when the blood glucose value is less than. So that is, by definition, is a low blood glucose, which we call hypoglycemia. So how these patients can present? What would the symptoms? So symptoms would be perspiration. They can have tremors. They will feel hungry. They will have there will be anxiety, restlessness. So these are some of the symptoms. And if it is not detected initially, the child may become unconscious also. So how to treat it? How to at that moment only. So what we recommend usually, that the child who is having type 1 diabetes, he should have his these things which I will enumerate now with him at all times. These are his insulin, his glucometer, his glucose tablets or glucose powder should be with him. A small snack if he is outside his house. Snack meaning anything like roasted chana or roasted groundnut, something like that. And if the child is affordable or his parents are affordable, then a glucagon injection or a glucagon nasal spray should be with him. So what should we do? If a child is conscious, if he is able to communicate with his parents or his peers, in that case, just he can take 1 or 2 glucose tablets. He can dissolve it in a little bit of water and take it. Just recheck the blood glucose after 15 minutes. If it is more than 70, then it's okay. Otherwise, again take 2 or 3 tablets of glucose, and this cycle has to be repeated till his blood glucose comes more than 70. But he should not become callous after once his blood glucose is more than 70, because this glucose will last only for a few minutes or 15 to 20 minutes only. So to avoid that, he has to take something else. Like if he's outside his house, he can take that snack which he's carrying with him. Or if he's in his house, he can take half chapati or 1 chapati or a little bit of whatever carb or protein thing he's having in his house. So another problem will be if a child is unconscious, then what should the parents or the peers do? If the child is having that glucagon injection with him or glucagon nasal spray with him, they can use that. Or if it is not there, in that case, they should not force the glucose in his mouth, because child may aspirate and that may cause further problems. What they can do is just take a bit of glucose and keep it inside his sublingual region. Just keep it there, a little bit of glucose, and take that child immediately to the hospital.
Right, right. So, if a child has type 1 diabetes, will he or she need to take insulin for the rest of that person's life? Dr. Pramanik.
Yeah. So, thank you for the question. I believe Dr. Anish Behl has clearly mentioned that insulin is the mainstay of therapy for all type 1 diabetic patients, and any other oral tablet is not at all worthy to be used in type 1 diabetes. So, type 1 is always insulin. No confusion here. Now, there are different advertisements nowadays you can see in different social media platform, even sometime in newspaper as well, that they can cure type 1 diabetes even without insulin. As an endocrinologist, it's our urge not to follow those advertisements, and please stick to insulin until you have any other proven therapy for type 1 diabetes. Now, two scenarios I am going to discuss here, where transiently, one scenario is where transiently patient can be okay without insulin. That's called a honeymoon phase of type 1 diabetes. So, when type 1 diabetes is diagnosed, the patient gets admitted maybe with ketoacidosis sometimes, maybe just with high blood sugar sometimes, and after initial treatment, there's sometimes restoration of the insulin secretory capacity. So, in that phase, many patients, they often do not need insulin, or even if need, they need a very low dose of insulin. But we should not confuse it as a cure. Why? Because this honeymoon phase is not going to last long, and very soon the patient is going to have a florid type 1 diabetes which requires insulin therapy for rest of his or her life. Now, insulin can be given as in subcutaneous form, in injectable, or it can be given as a pump. But the main motto of this question was that whether they can get rid of insulin therapy. The answer as of now is no, because the only other way to stop insulin is islet cell transplant, which is still under investigation. And in India, still there is no successful cases of islet cell transplant. In other countries, the active research is going on, but it's still not recommended in any of the guidelines. But maybe after, as science progresses, after 4-5 years or 10 years, like renal transplant, like hepatic transplant, islet transplant will also be a successful mode of treatment. And only in that scenario, the type 1 diabetes patients may get rid of insulin. Till then, it's insulin, insulin and insulin for all type 1 diabetic patients.
Right. Thank you so much, Dr. Pramanik, as well as Dr. Behl and Dr. Thakur, for joining us on our show Health and Wellness, Myth versus Facts. Thank you so much for your time.